So when I say I look at the individual, I ask a lot of questions. What's your desire for your health? What if I was on a CPAP machine and now I've had a balloon surgery to my stomach and I lose 50 pounds? Do I still need to stay on my CPAP machine? Maybe not. I can see from your forms, for example, that you have this and this and this. Did you know that there's a connection between this and sleep and breathing issues and sleep disordered breathing issues and underdeveloped jaws? If we do a 3D analysis of their head and neck region, I get to see their airway, I get to see the dimensions of their airway, and I show them what that is. We move jaws, we change jaw structures, we move teeth to make the boxes bigger. If I make the jaws bigger, now the tongue has a bigger package to sit within. Now the tongue is trained to sit further forward. Now it's out of the airway so that person can breathe better. Sometimes I have to hold the jaw when they sleep, so there's specialized appliances that I make. We reduce the soft palates, we shrink the size of the soft palates. Somebody needs to be overseeing this and paying attention to that stuff. And in my experience, I get to be a huge advocate for my medical colleagues who might not be seeing these patients as often as I am and as frequent as I am.